Hello everyone, this is Lauren Anthus with the Center for Community Solutions. I'm joined today by my colleagues Will Tarter Jr. and Bree Lushik from the policy team. Will be handling our questions, which we ask that you please write in the dialog box, and then we will answer at the conclusion of today's webinar. I would also say that slides will be made available at the end of our presentation today, and I should note too that our State Budgeting Matters series of papers will be made available tomorrow, which will go more in depth on the issues that we will be covering today. So with that, we will get started. Sorry, we have a little bit of lag here on our end. Just 1 second. There we go. Okay, so that's us in person. There's Bree Lushik, our Public Policy Associate. You can see our contact information there. If you do not already, please follow us on Twitter. We ask that you feel free to follow up on any questions that you may have for us directly. Okay, for today's presentation, we're going to be covering 6 departments: the Mental Health and Addiction Services, the Ohio Department of Medicaid, the Ohio Department of Health, the Ohio Department of Aging, and Developmental Disabilities, as well as Job and Family Services. First, with the Ohio Department of Mental Health and Addiction Services. The Ohio Department of Mental Health and Addiction Services is responsible for the provision and oversight of statewide mental health services, as well as addiction and alcohol prevention, treatment, and recovery supports. ODMHS, AAS, oversees, regulates, and allocates funding to a service system of 52 county behavioral health boards and operates 6 regional psychiatric hospitals. Despite state revenue lagging behind projections and resulting in cuts throughout the budget, the Department of Mental Health and Addiction Services saw over a 2% increase in its GRF funding in both 2018 and 2019, as well as a 30% increase in non-GRF funding in fiscal year 2018. These increased investments come at a time when the state is continuing to search for new ways to address the growing behavioral health needs propelled by the opiate crisis. In a plan called Ohio Hopes, standing for Heroin Opioids Prevention, Education, and Safety, the House budget featured a funding package of $170.6 million over the biennium to support behavioral health services addressing growing needs created by the state's opiate crisis. Though the plan underwent substantial revision by the Senate and conference committees, the enacted budget added to the House's total by using dedicated purpose funds, leveraging federal dollars, and redirecting local government fund dollars towards several new behavioral health programs. The roughly $180 million in new funding for the opiate crisis is appropriated across multiple state agencies in addition to the Department of Mental Health and Addiction Services, including the Departments of Job and Family Services, Rehabilitation and Correction, Public Safety, the Attorney General's Office, and the State Board of Pharmacy. Of this money, approximately $75 million was appropriated by the Ohio Department of Mental Health and Addiction Services over the biennium for the following purposes: $14 million in general revenue and redirected LGF dollars to be distributed across county behavioral health boards, $2 million in additional funding for the Residential State Supplement Program, allowing facilities participating in the program to accommodate and provide personal care services to more individuals with mental illness, $12 million in redirected local government fund dollars for substance use abuse stabilization centers or detox facilities, and $3 million in general revenue dollars for mental health crisis stabilization centers in each of the state's 6 psychiatric hospital regions, $7 million to expand medication-assisted treatment, drug court, and mental health court pilot programs to new counties, $5 million to reimburse county jails for psychotropic drugs dispensed to inmates, $21 million in additional capacity to sell obligations against the Mental Health Facilities Improvement Fund to expand treatment facilities, and $11 million in federal 21st Century Cures Act funding to be used pursuant to the state targeted resource response to the opiate crisis provision in the Act. Behavioral health redesign. Governor Kasich vetoed a provision in the budget that would have further delayed alcohol, drug addiction, and mental health services from being carved into Medicaid managed care until July 1st, 2018. Therefore, all elements of the behavioral health redesign are currently scheduled for implementation on the latter of January 1st, 2018, or when beta testing of the new Medicaid reimbursement codes has been successfully completed. Though the House of Representatives has overridden the governor's veto of the delay, it is unclear whether the Senate will follow suit, considering the Senate-passed budget had an implementation date of January 1st, 2018. The budget also requires the Department of Mental Health and Addiction Services and the Department of Medicaid to adopt rules and make available provider manuals, claim instructions, information technology resources, and other training resources for the behavioral health redesign no later than October 1st of this year. Additionally, the administration is working with hospitals to make available behavioral health services for children and multi-system youth through Medicaid managed care by August 1st of this year. So that happened about a couple days ago. Since hospitals have indicated they are prepared to move forward with these changes. Detailed updates of the behavioral health redesign process can be found on our blog, which you can find at www.communitysolutions.com. Regarding opioid addiction hubs, the enacted budget maintained the House's county hub program to combat opioid addiction and requires each county Adams board to organize and coordinate efforts to address the opioid epidemic in their county or counties and submit a report on these efforts to the department. Though the House initially appropriated $2.2 million in fiscal year 18 for this program, the final budget eliminated this funding, leaving the cost of implementing the program to fall on county boards. Regarding prevention, after both the governor's budget and the House-passed budget preserved general revenue funding for prevention and wellness line item at the 2017 level of $3.4 million, the enacted budget cut this funding by 22% to $2.6 million in each fiscal year. The reduction in this line item means fewer funds are available for schools and county behavioral health boards to provide evidence-based substance use and suicide prevention programming. However, it is possible that this loss in prevention funding may be offset by a nearly $20 million increase to the statewide treatment and prevention dedicated purpose fund over the biennium. Regarding multi-system youth, the enacted version of the budget preserved provisions made by the Senate to implement recommendations made by the Joint Legislative Committee on Multi-System Youth, which was created by the 2016-17 state budget. Specifically, $5 million in unspent federal Tanf funds will be appropriated in each fiscal year to create a Youth and Family Crisis Stabilization Fund. This funding will increase access to treatment and supports for children and adolescents with complex mental health, addiction, or developmental needs that cannot be met by a single care system. Additionally, the budget calls for the department to establish a strategy to collect and share data across child-serving systems to create a clearer picture of service utilization, patterns and gaps, and outcomes. The availability of such comprehensive data may enable a more holistic approach to ensuring evidence-based services are available for youth involved in the behavioral health, child protection, juvenile justice, and/or developmental disability systems. The Center for Community Solutions advocated for this throughout the state budget process and these policy recommendations that are entailed, and continues to advocate on behalf of youth with complex care needs to ensure they have access to quality services and supports. In particular, Community Solutions is monitoring the impact of behavioral health redesign efforts on multi-system youth. Now moving on to the Ohio Department of Medicaid. The Ohio Department of Medicaid, so the most notable change here in the appropriation levels with the budget for the Ohio Department of Medicaid come from the reduction in state contributions and the increase of non-GRF contributions. This is due to the influence of two specific line items dealing with the new Health Insurance Corporation, or HIC fee, line item 651684, and the increase of federal matching dollars, line item 651623. The latter line item is responsible for the bulk of the shift, roughly $2.6 billion, something which is influenced in part by the federal funding being drawn down from the result of the HIC. At a normal match rate of about 63%, the state would be able to leverage about $2.1 billion in federal matching funds. This amount could be higher if other matching rates would be applied. As described in earlier reports that we have published, the administration sought to implement several policies that would alter payments to nursing facilities and hospitals. These policies included the removal of a special protection afforded to nursing facility reimbursement in Ohio Revised Code, efforts to increase quality in those settings, rules around coding changes for hospitals, and a policy which would compel hospitals to contract with managed care at governmental rates if they could not agree to a contract with any given plan. Interestingly, this last item, known as non-contracting, may have impacted the current termination of the contract between Cleveland Clinic and CareSource, Ohio's largest Medicaid plan. With that said, according to the Ohio Office of Health Transformation, the legislature counted on the appropriation levels associated with these policies. But as a result of the budget process, the policies were stricken, meaning that the administration was no longer able to achieve the savings they sought in their initial proposal because the appropriation level associated with these policies remained. In summary, this $1.4 billion shortfall is represented by $237 million in foregone nursing facility policy and a $1.1 billion gap in hospital policy. Because nursing facilities are protected in law, the state cannot leverage its rulemaking authority to change their rates. That means the other providers who service the Medicaid program may be subject to a rate cut, which, according to the administration, is about 7% across the board. Advocates have made claims that they believe this budget, in part because of this issue, was not balanced. However, as the appropriation levels are what is established in the budget, not the guarantee of said rates, it appears the administration is well within their legal authority to pursue rate cuts. At this point, the administration is engaging provider groups to negotiate the issue, but it's worthwhile to note the inflexibility of reimbursement associated with nursing facilities and the legislating of Medicaid authority of providers generally has in terms of the final budget. The conference process included several provisions which increased the influence of the General Assembly in the day-to-day management of the Medicaid program. This included proposals which would eliminate the abilities of the Ohio Department of Medicaid to cover optional eligibility groups without statutory approval, to establish new rates for provider groups without submitting and receiving tacit approval from the Joint Medicaid Oversight Committee regarding those proposals, and it would require the director to seek funding from the controlling board to pay for expenses in the program. All three of these items were vetoed by the governor, and all three were overridden by the House. Given the uncertainty of these provisions before the Senate, and in general, language from the governor's vetoes may provide some insight into the policy background of the options moving forward. First, in regards to eligibility, the governor cited that, quote, ceding a portion of the director of Medicaid's authority to the legislature, end quote, violated federal law. It appears that this may mean that any further efforts to enact eligibility policy through law may run into legal issues in the eyes of the administration. Regarding the rate oversight, the governor highlighted the inflexibility that such a process would entail, specifically citing how it would fundamentally alter the relationship between the department and JMOC. Last, regarding the controlling board approval of Medicaid funds, the veto message stated that they, quote, do not oppose the requirement, end quote, but that it prohibits the board from releasing funds if the federal match changes due to congressional action. With the recent defeat of the proposal in Congress to alter Medicaid financing, this provision may return in the Senate as it appears there will be more stability in the federal funding during the biennium. While it was not a part of the override process, the governor vetoed a few other provisions regarding general eligibility and the delivery system. One provision would have frozen enrollment for the Medicaid expansion by July 2018. Advocates had organized against this issue, citing concerns about continuity of care, especially in the context of access to addiction treatment. In the governor's veto, he highlighted the fact that this potentially violated federal law, a sentiment carried forward by advocates stating it would be a violation of the Equal Protection Clause. It should be noted that while the House did not override this veto, it does not prohibit them from taking up the issue at any point during the General Assembly. The governor also vetoed the provisions around delaying the transition to long-term care and behavioral health populations into managed care. And these two provisions were overridden, interestingly, with overwhelming support from both sides of the aisle. Beyond these major structural issues for ODM, it may be worthwhile to note several other policy changes that survived the governor's veto pen. One item which was overridden was the changes to the managed care tax. Initially, the legislature proposed an increase in the fees that would be collected from plans as a way to supplement the funding to counties and regional tax authorities. The policy would require the director to work with the Center for Medicare and Medicaid Services, or CMS, to increase the fee percentage from 5.8 to 7.2%. In his veto, the governor pointed to the fact that this may compromise the current waiver CMS has approved, though that was refuted by members of the General Assembly. What's more, it's important to note that the 7.2% standard exceeds the safe harbor threshold of provider taxes at 6%, a limit on Medicaid-based taxes assessed to providers for the purposes of drawing down federal funds. In addition to the oversight regarding the operational authority of the director, the General Assembly sought multiple waivers regarding the operation of Medicaid in Ohio. First, there was a proposal to seek an 1115 demonstration waiver so that Medicaid reimbursement of behavioral health services in inpatient settings could be expanded. As we have written about previously, this would seem to be duplicative of efforts that are currently being developed by the state in response to the federal managed care rule from 2016, something which was cited in the governor's veto message. Second, there was an effort to resurrect the, quote, Healthy Ohio, quote, waiver from 2016, as well as a policy seeking to impose a work requirement on Medicaid expansion enrollees with a few exemptions. Interestingly, the governor's veto on Healthy Ohio, which was overridden by the House, mentioned the fact that it would require the director to submit an identical proposal to the one which was rejected by CMS. The veto does explain that the administration would still like to pursue a policy which increases the enrollment requirements of participants, but that the veto is necessary in order to maintain policy flexibility. The work requirement language was not vetoed and remains policy. In all likelihood, it is possible that the administration, rather than seeking out two separate waivers, will seek out a single waiver with both the work requirements and the cost-sharing elements. This waiver would still be subject to the public comment process set in federal law, and you can learn more about that on our website at communitysolutions.com/Medicaid. It should be noted that the work requirements may also violate the Administrative Procedure Act, or APA. To explain, the APA allows federal courts to review 1115 demonstration waivers under the arbitrary and capricious standard. While this does not mean judges can substitute their opinion of policy in place of that of the Secretary, it may mean that parties opposed to a work requirement could present a legal challenge to the policies being sought. And, as the legal analysis previously cited from the Congressional Research Service has noted, courts will look at the waiver's research or experimental goals, the potential impact on program beneficiaries, and objections raised concerning the proposal. Last, comprehensive primary care, the multi-year policy which incentivizes primary care coordination, survived the legislative process. This was initially in question after the House had eliminated it, but through continuance, maintains one of the hallmark programs of the administration in its work on value-based reimbursement. The Care and Innovation Community Improvement Program, which was created, which allows a nonprofit hospital affiliated with the university and a public hospital agency to provide state money for the purposes of drawing down matching funds from the federal government. This program, which appears to be a public hospital UPL program, or upper payment limit program, allows hospitals to use their funds in an amount up to $60 million for the purposes of drawing down federal funds upwards of $140 million each fiscal year. With that, that concludes the presentations on Medicaid, and I would now like to move to the Department of Health. Outside of a largely symbolic effort to enroll Ohio in a health care compact, the Ohio Department of Health was immune to the effects of the governor's veto pen and that of the House override process. That said, a number of policies dealing with children with special needs, HIV/AIDS, lead abatement, and tobacco cessation were still deliberated and enacted, though there were no significant changes between the Senate-passed version of ODH's budget and the one enrolled through conference and signed by the governor. All funding associated with tobacco cessation and infant mortality, as we have detailed before, was maintained, with the former being responsible for the dedicated purpose fund changes, with an increase of from just under $2 million to $12.5 million each fiscal year. BCMH. In the governor's proposal, the Bureau of Children with Medical Handicaps, or BCMH, was supposed to be transitioned out of the Department of Health and into Ohio's Medicaid program. After pushback from advocates concerned that this would limit eligibility in the program for children with special needs, the House removed this initiative. This removal is maintained throughout the budget, and BCMH remains. HIV/AIDS. One provision in the budget would require that information regarding an HIV test may be disclosed to a physician who treats that patient. In the executive and House versions, that policy specified that an individual's records and information maintained by a drug treatment program may be disclosed without consent to clinicians, including doctors, advanced practice nurses, and physician's assistants. This provision regarding disclosure was removed in the Senate. Lead. In regards to lead, the administration's proposal around lead-safe residential units was maintained. This policy included the creation of a registry to which homeowners could contribute and the establishment of a training program for persons interested in conducting residential rental unit lead-safe maintenance practices. Additionally, a provision inserted in the House would give sole and exclusive authority to the department to regulate lead abatement. This provision was opposed by municipalities and housing advocates who were successful in having that provision removed, thus allowing cities to maintain their authority. There was also the creation of a new General Revenue Fund, 440527, which set aside $150,000 per fiscal year for lead abatement. Last, the LED Funding Partnership, a $5 million per fiscal year collaborative initiative between ODH and ODM, will also be pursued. This effort involves the state submitting a state Medicaid plan amendment to the federal government to leverage the Children's Health Insurance Program, or CHIP, to help homeowners address lead hazards in their home. That concludes the presentation on the Department of Health. I would now like to hand it over to my colleague, Bree Leshek, who's going to start with the Ohio Department of Aging.
Good afternoon, everyone. As Lauren said, I'm going to start with the Department of Aging, and I'm just going to start things off. As you can see here, there was a slight increase in GRF funding from fiscal year 2016 to fiscal year 2017 that was reversed from fiscal year 2017 to fiscal year 2018, where the general revenue funds decreased 5.7% and the non-GRF funds increased significantly by 20%. It's a trend you saw from Lauren's presentations and you'll continue to see through Aging, DODD, and JFS. Those non-GRF funds consist of the Dedicated Purpose Fund group, where line items like ombudsman supports are placed. There was a 103% increase in that fund group. The federal fund group included a 16.5% increase. For federal independent services made up the bulk of that increase. Those funds are used to provide social services for the elderly, as well as provide congregate and home-delivered meals and funding for ombudsman activities. Provisions. Assisted living. The assisted living program saw a number of changes throughout the budget process. A House provision that would have eliminated ODA's ability to set rates was removed by the Senate and remained out of the enacted version of the budget. A provision like this may have hindered incentive for providers to deliver assisted living services, possibly impacting the quality of care for Ohio's growing aging population. In addition, assisted living provisions would have granted the director of ODA the ability to include additional settings where assisted living services could be provided via rule. The provision was removed from the budget and remained out in the enacted version. However, on this same note, the enacted version of the budget creates a work group to review assisted living programs and examine additional settings where assisted living could be provided. This work group will allow additional examination to be made on the program before any drastic changes are made or implemented going forward. And then here I wanted to point out three specific line item changes that I thought were significantly impactful for the agency. The ombudsman supports, the as introduced version of the budget increased ombudsman supports line item by 64% from its fiscal year 2017 expenditures of $219.6 thousand. The enacted version of the budget reduced the initial increase by 26.8%. Remaining are an additional $1.2 million from fiscal year 2017 spending in both 2018 and 2019. These additional dollars will fund the state long-term care ombudsman office. Senior Community Service. The enacted version of the budget further deepened the House's cut to the Senior Community Service line item. The House and Senate version of the budget decreased funding by a combined 3%. The enacted version may highly impact the state's ability to draw down funds from the federal government's Older Americans Act, hindering the state's ability to maintain their share of the funds through maintenance of effort. But this is still playing out, and we will see more details on how other state or local funds could be used to leverage the Older American Act funds and the Green Books are in coming months from the Department of Aging themselves. Sorry, let me move back. National Senior Service Corps. Line item was cut by over 2% from fiscal year 2017 spending levels in the enacted version of the budget. The nearly $5,000 decrease will affect the mentoring and tutoring of at-risk children, services to homebound seniors, staffing for homeless shelters, and food banks. And just to note here, the as-introduced version of the budget did seek to increase this line item from the $227,000 spent in 2017 to about $241,000. Combined, both the House and Senate passed version of the budget cut the introduced amount by 6.3%. in fiscal year 2018. Adult Protective Services. A lot has happened with APS in the budget, so I'd like to kind of give an overview of some things that were happening before the budget in the legislature, just to give some context as to where these provisions kind of came from. House Bill 78, this is the third General Assembly this bill was introduced, and it was introduced in the House and moved to the committee process where it was awaiting additional hearings in the House Aging Committee. The bulk of this bill is actually what we see added into the budget. Senate Bill 158 addresses fraud crimes perpetrated against senior citizens, and on June 20th, it had its first hearing in the Senate Judiciary Committee. It also increases the penalties for theft from a person in a protected class and a whole host of other things, including adding a number of individuals to a mandatory reporters, specifically around the financial sector. These individuals were actually included in the budget. It also requires the Attorney General to publish public service announcements that provide general information on elder fraud and financial exploitation. In the budget, however, additional provisions that were added include definitions like home health agency, expanding the mandatory reporters, as I mentioned, with Senate Bill 158, that includes individuals in the financial sector. Prosecutor authority to petition courts, requires county departments of JFS to notify local law enforcement agency if it has reasonable cause to believe there is exploitation occurring, allows for law enforcement prosecutor reimbursements, modifies release of information policy from statewide APS IT system, formally creates Elder Abuse Commission, which resides in the Attorney General's office, repeals the Memorandum of Understanding, requires JFS to provide training and make educational materials available and facilitate interagency cooperations. Vetoed by the governor was the provision that would have allowed for law enforcement and prosecutors reimbursements. So moving on, and I just want to actually note here, APS resides in Department of Job and Family Services, but since it has such an impact on individuals that are aging, I really wanted to include that in the aging portion. So just wanted to let anybody know that if they thought it was kind of funny to include it there, even though it is kind of housed within JFS. So moving on to the Department of Developmental Disabilities. General overview. Both GRF and non-GRF received funding increases in fiscal year 2018 and 2019. Community supports and rental systems made up the largest increase in GRF funding groups. Community supports and rental assistance is used to provide county DD boards with funding for rental assistance for individuals who are currently receiving home and community-based services and to former residents of ICFs or developmental centers. This is a key component of community transitions. Non-GRF in DODD includes funding groups such as dedicated purpose funds and federal, just like the Department of Aging, but also includes internal service activity fund group. The greatest increase in non-GRF was for ICF IID waiver match, which I'll go into that in just a little bit more. Policy changes. Ventilators. Provisions were added to the enacted version of the budget that removed the age requirement for individuals utilizing ventilators in certain settings. Traditionally, individuals over the age of 21 would need to be in a hospital setting to receive treatment from a ventilator. Supported living. Though the House version of the budget did make various changes around supported living program, those changes remained out in the enacted version of the budget. Changes the House proposed would have extended renewal for supported living certificates and would have extended county involvement in administering those supported living certificates. Help Me Grow. Through the budget process, various changes were added to the way Help Me Grow program is administered, and specifications were added to the roles of DODD and the Department of Health that appeared kind of particularly burdensome. Remaining in the enacted version of the budget are provisions added by the House to clarify central intake and referral system for early intervention funds and shared funding between the two departments. The MBR last year moved a lot of the help me grow responsibilities to the Department of Developmental Disabilities. So these provisions are more likely a response to those changes as they kind of have played out. Workforce. In a DoDD blog post that came out in mid-July, the department outlined their budget initiatives. In that, they provided an estimate for waivers and highlighted some workforce initiatives around direct support staff. Specifically, direct support staff with 2 years experience and 60 hours of training will be eligible to receive wage increases beginning next July, so the July 2018. Additionally, they outlined a provision that would provide funding for a nurse to consult staff and provide training. The nature of DoDD's discretionary funding makes it difficult to determine how funds will specifically be used, but we will be following this more as the green books come out and as the department updates us on how funds will be used, like the communications post I just referenced. Waivers. Last budget created 3,000 state-funded waivers, which included a little more than 1,800 waivers that were targeted to individuals on waiting lists, and 1,136 specifically intended for those currently living in an institution or those being diverted from an institution who would like to live in the community. The as-introduced amount would have included funding for approximately 1,300 new home and community-based waivers. I want to highlight here the 4 line items that allow DoD to create additional waivers. Those are the Medicaid services, ICF and IID waiver match, County Board waiver match, and the Medicaid Service Fund. Increases to these line items will create approximately 750 new waivers. And I got that 750 number kind of where I got the workforce initiatives from, and that was that DoDD communications blog that came out. Moving on to the Ohio Department of Job and Family Services. Like DoDD, ODJFS saw an overall increase in both GRF and non-GRF. GRF saw the largest increase in families and children programs. That's 128.3%. That line item provides funding for payroll, conference fees, maintenance, and equipment for child welfare services provided by the Office of Families and Children. Large increases in non-GRF funds came from a few line items, but most noticeably are the increases to audit, settlement, and contingencies used for expenditures towards audits, settlements, and contingencies and other related expenses. That was a 1,062.8% increase, or works out to be $4.5 million in that line item. A 1,009.8% increase to the state and county shared services, or $1.8 million, will be used for computer-related purchases and equipment. The Tanf block grant saw one of the largest dollar amount increases at $126.5 million change from fiscal year 2017. This is one of those changes that really needs to materialize through those additional documents from JFS, i.e. the Tanf spending plan. Here are some policy changes. The Disability Financial Assistance Program remained out of the budget in the enacted version. Provisions were included for the use of county administrative funds to be used while operating the remainder of the program. In addition, enacted version of the budget requires the Executive Director of Office of Health Transformation to create a program that will assist Medicaid recipients in expediting applications for federal benefits, and that provision would include applications for individuals that would currently be on DFA. The Healthier Buckeye program, it was an initiative created in the previous budget and was left out of the as-introduced version of the budget. Measures were added in the enacted version of the budget that create additional funding and the ability for State Council to continue and the remainder of funds to be spent by the end of the year. The program was appropriated $50,000 in each fiscal year in the Senate enacted version of the budget, which will be interesting to watch as things play out because there was a provision in the Senate that would have transferred funds from this account to general revenue funds. So I'm not really sure what the intent of that $50,000 is, but that is something the Green Books may give us more insight to once they're made available. Workforce development. WIOA changes. Changes were made in the budget that align align state law with federal requirements to the Federal Workforce Investment and Opportunities Act. CCMEP, the Comprehensive Case Management and Employment Program, age was expanded to include 14 and 15-year-olds, and that remained, that was in the as-introduced version of the budget and remained in the final version of the budget, in addition to formalizing the program and removing the expiration date. The enacted version of the budget also incorporated a House-passed provision that would identify in-demand jobs that pay 125% of the federal minimum wage. This provision creates a vital piece of information both for Ohioans who are looking for jobs and individuals who are preparing to enter the workforce. Temporary assistance for needy families. So the carryover amount. In the beginning, we kind of identified $191 million in the as-introduced version of the budget, and that amount was found by looking at underspend in the Red Book and comparing that with the block grant amount. The Red Book estimated the fiscal year 2017 spending came in at $644.8 million. However, the budget in detail from the enacted version of the budget shows 2017 actuals to be at $709.9 million. So that's roughly $65 million difference. So the rough math would lead me to believe there's about $126 million in carryover from that difference is from that $191.5 million that was originally identified by us. Additions in the House version of the budget added $10 million for kinship care and $1 million for Boys and Girls Clubs, but they also reduced money from the food banks, and so this is all Tanf funds. Additions in the Senate include $36.4 million in Tanf funds, so they really utilized that underspend, and so that's utilizing various programs, but most notably $5 million for multi-system youth and a total of $15 million for kinship care, and restored funding for food banks. So moving forward, we are left waiting for JFS to release the latest TANF spending plan to see how the use of additional TANF funds will be used by the department. And that's it for JFS. Any questions?
Thanks, Bree. If you haven't already done so, please feel free to submit your questions in the dialog box. We'll take a couple of minutes so that you can do that. Just a quick reminder, our series on the state budget, State Budgeting Matters, will come out tomorrow. It will also be linked to those will be included in our regular newsletter publications. If you have not signed up for our newsletters and are interested in not only those publications but others, please go to communitysolutions.com where you can find our regular blog posts, our State Budgeting Matter series, infographics, and other information about the spectrum of health and human services and its connection to public policy. I would also recommend that you follow us on Twitter if you have any questions whatsoever. So, you can follow our team at CCS Policy, or you can follow Bree or I or Tara Britton, our director, who's on leave at the moment, or will. And, feel free to engage us that way as well. So with that, we'll look at our first question here from our former executive director, John Magala. Were there any major changes in tax policies affecting GRF revenue? As far as tax policies go, I think the one that's probably most prescient in terms of what we cover today is around the managed care tax. We have a brief that we outlined relative to the managed care tax, how it's operated. We've actually had a history of publishing information on that tax and its construction. If anything, that particular program, because of its nature, has broad effects not only in the context of Medicaid, but also on local governments and regional transit authorities, which we have documented and others have documented. It still remains a point of conversation for the legislature and advocates, so we'll see where that goes. But being the sort of Medicaid geek, my largest concern really is how stable that source of funding will be long term, because it does depend on a waiver with the federal government. Because the funding that gets developed from that tax arrangement leverages significant resources for the Medicaid program in the state. So if there were any sort of changes to that, or the federal government decided to terminate the waiver at any point, it could certainly be excuse me, pretty bad for Ohio's budget process.
There was also a question about the green books, and I know that that was kind of addressed, but I just want to highlight that the green books are almost just like the red books, but only when everything is, all the ink is dried and everything is finalized, and they're a really good resource. They're kind of trickling out. I know that there are some posted on LSC's website right now, but those are expected to come out throughout the month. So just keep checking LSC's website. You're not going to be able to find any of the agencies that we highlighted today as of this moment. I did check a few hours ago, and they weren't up yet, but just continue to refresh that page every week or so, and they're a great resource for just kind of figuring out where each department landed. If it's not what we're talking about right now on this webinar, if it's something like tax, they have their own green books as well. So really utilize those. Just wanted to add that.
All right, we'll give it just one more minute here for anyone to submit questions they may have. All right. Seeing there are no questions at the moment, if anyone does have any questions that they would like answered directly, feel free to call us, tweet at us, email us. We'll be more than happy to answer them. And again, more in-depth publications will be coming out tomorrow. With that, on behalf of Bree and Will, I want to thank all of you for joining today. We will make sure that these slides and other materials will be distributed to all of you on the termination of this webinar. So with that, thank you for attending, and have a nice weekend. Take care.